It's really quite simple, and the entire evaluation can be completed within the first 2 weeks of your next menstrual cycle.
That was Dr. Joe Hill, and he's going to answer some of your questions today. We put the list of questions that will be addressed in this video here, and we added it below in the description as well. If this video isn't answering your question, don't worry. Write your question in a comment below so we can ask a doctor to include it in the video just for you. Well, for everybody, really. Okay, so today we're tackling questions around the infertility evaluation. The first question is, what is the doctor going to ask you about in the evaluation? So what kind of information should you be prepared to talk about?
They're going to ask you about, of course, your age, how many times have you been pregnant, the outcome of all those pregnancies, how long it's taken to become pregnant. They're also going to ask about medical history, past medical history in terms of, do you have a history of diabetes or hypertension, previous surgeries? Also, do you have any allergies, or do you smoke, either marijuana or vaping, any kind of tobacco or tobaccoless product? And they're going to ask this of you and your partner.
Okay, so be prepared to talk to the doctor about your previous attempts at conceiving, if there were any, your medical history, and any of the lifestyle things that you might expect. The next question we'll cover today is about the blood tests during the process. And the question is, what are the blood tests? And more to the point, what kind of information are the doctors getting from these blood tests?
The blood test is a hormone profile looking at certain hormones like FSH, estrogen, perhaps progesterone. But the most sensitive indicator is a hormone called AMH, anti-Mullerian hormone. And that tests one's ovarian reserve, because not every 35-year-old is 35. Some may be 32, some may be 38. And the AMH gives a handle on what your reserve is like. AMH is made in the ovary by cells that nurse the eggs. So if you have a lot of eggs, these cells are all happy, secreting lots of AMH. A good AMH is a level over 2. A poor AMH is less than 1. But we do have protocols that are designed to help women with lower AMH.
Yeah, so if you find out that you have low AMH, all might not be lost, as there's still hope in many cases. We have some videos about diminished ovarian reserve on our channel, so if that's a concern for you, you should go check those out. Now, unlike hit TV shows on Sunday nights, the initial evaluation isn't all talk and blood. There is another part of the evaluation for women, and that's an ultrasound. Which brings us to the question, what is the ultrasound and what are they looking for?
The ultrasound is looking for antral follicle count and looking to see if there are any lumps or bumps in the uterus. In the old days, we used to do a hysterosalpingogram. Now with a sophisticated sono HSG or sono histogram, we can get as much information as the HSG, which is a lot more painful. The sono HSG is less painful and literally takes 5 minutes to do. And what a sono HSG is, come in, put in the stirrups, put a speculum in, wash off the cervix with betadine. There's a little rubber catheter that goes through the cervix into the uterus, take out the speculum, a vaginal probe ultrasound goes in. Then you inject saline. That is associated with what has been described as a menstrual cramp. So take ibuprofen 800 milligrams an hour before, and one should do just fine. And that'll give us information that the uterine cavity itself has a regular contour, and that you can see free fluid in the pelvis, noting that a tube is open. And if a tube is dilated due to pelvic disease, hydrosalpinx, that should show up as well.
And that brings us to the final question we'll address in this video. And here's where I remind you to subscribe and check out all of our videos on our channel. Hit the like button a few times if you want. Maybe write a comment. It's up to you. Anyway, the final question in this video is, what about the male partner?
Then for the male, it's quite simple as well. Generally, a blood test for infectious disease parameters and a semen analysis. There are really only 3 things with semen analysis that are helpful: the count, the motility, and the morphology. Morphology means what they look like. A count should be over 20 million per milliliter. The motility should be at least 50% of them motile. That means alive. The morphology, ideally over 4%.
One final thing from me for the male side of the equation. If male infertility is diagnosed, the male might be referred to see a reproductive urologist. This opens up a ton of different questions, so we're putting that video here on the screen so you can go right to that. I want to thank Dr. Joe Hill for taking the time to answer our questions today, and I want to remind you that if you have any burning fertility or family building questions, you should leave them below in the comments, and we'll go talk to a doctor and make a video for you. Thank you.